webinar on coronavirus as well as Ask the Doctor About Parkinson Disease. I want to shout out to everyone that's out there. I know that you're in your homes and somewhat isolated and tough to get to the doctor and tough to get your questions answered. And so at the Parkinson's Foundation, we're here to help, and I'm going to try to stay on today. And we've been collecting questions that have come in, and we're going to make sure that we answer all of your questions and make sure that we make ourselves available to help you through this crisis. And we know that everybody's hurting, and it's a double hurt when you end up being socially isolated, quarantined, or have to stay within your own home. And then you can't get to the doctor, you can't get to your physical therapist, you can't get to your social workers, you can't get to your psychologists, and you can't get your rehabilitation therapies. So we completely understand what's going on, and we're here to help. So we're at Parkinson.org is our website, and we've set up sort of almost a corona crisis section of our website. It's not really a corona crisis, but it's all about corona, and it's at parkinson.org, /coronavirus, all one word, parkinson.org/coronavirus. And the other thing to tell you is that we hope that none of you have to go to the hospital. But in terms of the leadership here at the foundation, for the past 10 years, we've been leading on issues of keeping Parkinson patients safe in the hospital, and we've developed these really cool aware and care kits. And let me just stop for a minute and tell you about what that is. And so if you have to go to the hospital, now many of you have had kids, some of you may not, but when you do have a kid, particularly your first kid, you pack a bag, with some clothes and your medicines and all the things that you need if you have to go to the hospital. So you're totally ready for whatever is going to happen. And what we've done is we've created these, they're called Aware and Care Kits. Aware and Care Kits. They're available free from the Parkinson Foundation. And in fact, if you go to parkinson.org, there's a / to our store that's online, and you can get these, but they are free. We just passed giving out 100,000 of them. And what is so cool about them is that it has everything that you need to know and to do. So it's a great checklist for you, but it also has rip-off checklists where you put your medications and you put your all of the information and all the do's and don'ts for your doctors and nurses and staff taking care of you in the hospital, so they know what to do. And so they're able to give you the information that you need, and you can give them back in case they're not used to taking care of Parkinson patients. They can do it right. And so that's super helpful. And they also make sure that you get your meds on time every time, and they make sure that you're not getting medications that you shouldn't get, like certain dopamine blockers that might keep you in the hospital longer and cause some side effects and complications. And so I want to shout out to the Parkinson Foundation for that. Hopefully we keep you socially isolated, we keep you at home and safe, and you don't get the coronavirus. But if you do, you can order the Aware and Care Kits. We also have a 1-800 hotline, 1-800, the number 4PD-INFO, 1-800, the number 4PD-INFO. We have real nurses and real practitioners that answer your questions, and if they can't answer your question, they're going to call me and I'm going to answer it. So we want to make sure that you have access to information. Now, last week, a week ago, we had a great broadcast. 75,000 of you so far have watched that Facebook Live with all the common questions and answers about Parkinson and coronavirus. We had an expert here, an infectious disease expert named Fred Southwick, who's the chief of infectious diseases and just a great guy. And he was a great interview last week. And so that's up on the Parkinson Foundation. We want to shout out to Fred and say thank you. He has also put 4 more videos for those of you that are super advanced. These are really advanced, mostly for practitioners, but I know some of you are sitting at home and want to see the most advanced information. He wanted me to tell you he's got 4 more videos. We've got stuff up on the Corona site for Parkinson Foundation, and then I've got a link to all of his videos on my blog, which is Parkinsons with an S, Secrets. So actually Parkinson with no S and then the word secrets, all one word. So parkinsonsecrets.com. Also has a link, and it tells you all about Fred Southwick and also gives you information about all of the videos as well. And so with that, we are going to start today's podcast, and I'm watching all of your live feeds come in with your questions. We've had questions that have already been posted to us that you have sent in, so thank you very much for that. I'm going to answer the first question that I would say comes from every continent around the world, perhaps except for Antarctica. We haven't seen flow from Antarctica, but if you have questions in Antarctica, we're here for you. The first is, tell us about the myths. So there are several myths about coronavirus, and these myths include I should take saline, I should be gargling salt water, I should be shooting stuff up my nose, I should be eating lots of garlic and taking lots of garlic. Tell us, are those myths? Is that fact? Or is that fiction? Are those real or are those not real? The answer is those are all myths. So we do not have any evidence that saline, garlic, or gargling water is helpful for either prevention or treatment of the coronavirus at this time. If that information changes, because things can change, we're going to give you an update online, and next time we get on live, we'll give you that update. So thank you for that question. The next question comes to us from Miami, Florida. This is a question about caregivers. And this is one where I would say we have really reached a point where we're getting lots of calls on the helpline and lots of questions that go something like this. My relative is at home. I'm at home with my relative, but I can't handle them by myself. They're too hard to transfer. Maybe I'm smaller than they are. Maybe I can't pick up their weight. This is becoming a problem for me, and I need help. But I'm scared because everybody tells me if you bring people in from the outside, they can be vectors, which means they can carry the coronavirus to me and to my loved one. So what do? I feel like I'm not giving, the best possible care to my loved one, and at the same time, I want to protect against coronavirus. So give me a little bit of advice. So this is a really tough question, and I thank Miami, Florida for sending it in. We need to be extremely thoughtful about these situations. Now, the first thing I will say is that some people are already in rehabilitation facilities and in facilities where they're socially isolated, and you can only talk with them by telephone or by telelink, and that's frustrating. But sometimes because of the level of care that they require, that might be safer for them to stay in that environment where the carers are at. Now, when you have a situation where you're having a caregiver come in and out of the house a lot, that does create increased risk for spread of coronavirus to your Parkinson, either relative or person that is staying within your home setting. Because of that, we recommend that you try to reduce the number of people coming in, ideally to 1, maybe 2, reduce the number of people coming in, make sure that you have sat them down regularly and you've gone over and you've educated them about the idea that they are carrying potentially the virus when they come back. And so it could be life-saving for them to go home, stay out of crowds, stay socially isolated themselves, and not carry the virus back to you. And the continuous limiting of people and continuous education and pounding on that principle that they can bring the virus back. Having said that, if it creates a lot of risk for a patient at home, and the risk is something about, well, we could fall or we could have a bad outcome, then you could be shooting yourself in the foot by not letting some of the medical professionals come in. So limiting them, continuous education, And then the last thing that was suggested by someone, which I learned from all of you, it's not like I wake up in the morning with all the answers, is in some cases, nannies for families can move in temporarily, and that solves the problem. And sometimes caregivers can be offered a package where they can move in temporarily if they're exclusive. That can also reduce the spread. So thank you, Miami, Florida, for that question. So I'm going to move to our next question live here. I have a question. This is from Michael, and I don't have the location where Michael is, but he asks a great question. He says, if you have a deep brain stimulator implanted, so these are the wires that go into the brain with usually a battery like a pacemaker in your chest that's helping to treat your symptoms. If you have a deep brain stimulator implanted, okay, and you need to have the battery replaced, so the juice goes out in the middle of the coronavirus, is that an elective procedure, or is that a required procedure, an urgent, time-sensitive procedure? Now, this is a great question, Michael. I thank you for sending it in, and let's go over this. Now, what we know, and there are multiple studies that have shown this in the literature, is that as batteries are running out with DBS, or if they run out, you can get a rebound of symptoms. A rebound meaning a worsening of symptoms. Tremor, stiffness, slowness, dyskinesias can be very severe in some of the patients when the batteries run out. As the battery is even running down, when it's not totally out, we see these symptoms. That's been documented in the literature. When batteries run completely out, there have been a few cases of something called a neuroleptic-like malignant syndrome. That sometimes the temperature goes up, you can go into extra movements, require an intensive care unit setting. This is something that can become very worrisome. So if you have a deep brain stimulator for Parkinson's disease, and if it is providing very good benefit for you, very noticeable benefit, and the battery runs out, in most cases you want to try to push to have that battery replaced in Parkinson as not an elective procedure. Now, if you have a little bit of tremor only and the DBS is in just for the tremor, and you can take it when the battery goes out, or maybe you've only got one DBS on one side of your brain and you got a little bit of tremor, a little bit of stiffness, and you think you're not going to miss it, and we can adjust medications and do things for you in the interim time, then it might be safer to wait in a case like that. But the majority of cases with Parkinson's disease and with another disease called generalized dystonia, where your whole body can go into spasm, it is something where we consider it to be really important to get your battery replaced. Now, in terms of doing new deep brain stimulation surgeries, it's important to note that we're not doing new cases. So unless it's an emergency, as a new case, like somebody has movements that we can't stop, unless we get in there and it's providing great disability or some risk to life, we're not going to do a deep brain stimulation, put a new device in. But for battery changes, we have to be really careful, and it could be a real disaster to let batteries run out. And so the issue is that hospitals are limited on their elective surgery capacity, not only for your safety to decrease spread of the virus to you, but also by doing less cases, it makes more protective gear, available for other people that need it during the coronavirus pandemic. Okay. And so with that, I just want you to keep that in mind. If you decide to try to wait and your symptoms really start to rebound badly, you could get into trouble. And so make sure you're talking to your deep brain stimulation team and making that decision together. So at least if you don't do it, they can be watching you and they can move in really quickly if they need to move in. So Michael, great question. Thank you for that question. We also have some information on battery changes. We're updating all of the new information on our blogs, both at parkinson.org, and I've got information on battery changes on our blog at parkinsonsecrets.com. So thank you. I think that's super important. And so I would like to move on to our next question here. And then the next question has to do with the filler within medications. And so sometimes there are other components within a pill that are, referred to by this particular caller as a filler, okay, meaning that when you're manufactured, there's the actual active amount of the medicine, and then there's inactive ingredients like dyes and other things that are within those pills. So during this crisis, the corona crisis, this is a great question, so I want everybody to listen to this. Do we need to be concerned? Because what might happen is we're going to end up in some situations having a pill that's made by a different manufacturer. So it might have a different color, it might have different side ingredients in it, and in fact, it might not work exactly the same, even if it has the same name on the pill, okay? This is actually the same question that we get routinely when we're talking about people getting generics versus branded medication, okay? And we wrote a review article on this a number of years ago in Parkinsonism and related disorders. And let me give you the punchlines, from that. The punchlines are that when a medicine goes off patent, okay, so it's on patent for a certain number of years, then people start making generics and all sorts of different forms of the medicine. Guess what? You only have to have, if the United States Food and Drug Administration, within 20% bioavailability, only 20% bioavailability, okay, when the medicine goes off patent, okay? And because of that, because of this bioavailability, that means that any drug made by any manufacturer at any point in the United States, or a lot of you are watching from global locations, so factories from all other areas, could be China, could be Brazil, fill in the Mad Lib. It means that when you go to a pill from a different manufacturer, you shouldn't panic. You shouldn't say it's not going to work, okay? But it could be a little stronger or it could be a little weaker. So the dose of your medicine and the frequency that we tell you to take the medicine, okay, will need to be adjusted by your healthcare team, either your advanced practice provider or your physician, okay? So it's super important to remember that. The last point is that if you feel like you're getting an allergic reaction to your Sinemet, this is extremely rare, but during crises, people panic because they can't get to healthcare. It's usually, if it is a true allergy to Sinemet, carbidopa, levodopa, it's usually because the pill is yellow, and it's usually because of the yellow dye in the pill, okay? And a lot of these patients also have an aspirin allergy. And so we tell people, switch to a blue pill. Ask your pharmacist, give me a blue, even if it's extended release, okay? And in most cases, it is really rare. Less than 1 in 100. It's super rare. But if you feel that's an issue during a crisis, I don't want you to feel like you don't have anything that you can do while you're stuck. So thank you so much for that question. Let's move on and see we've got a bunch of other questions. So thank you, everybody. I see Costa Rica has signed on, and so welcome to Costa Rica. And I'm seeing questions from Fort Lauderdale, Florida. I'm seeing questions from the Midwest. So let's talk about vaccinations, okay? Do we recommend getting a vaccination, okay? A flu vaccination first. Yes. Everybody with Parkinson's disease should get a flu vaccination, period, okay? I don't want to be hazy on that issue. There's also a second vaccination called a pneumovax, okay? A pneumovax is for bacterial causes of pneumonia, okay? A flu vaccination is for viral causes of these upper respiratory symptoms and other symptoms that come with the influenza virus, okay? So one is for a virus, one is for a bacteria. Definitely get the flu shot. I say to my patients, definitely get the pneumovax shot as well, because that'll protect you from bacterial pneumonias. Some insurance companies won't pay for the shot, or some healthcare providers or governments, unless you're a certain age. Okay, so there'll maybe be a little discrimination with your age, but a lot of times you could pay out of pocket, you know, a few $100 or less if you wanted to get the pneumovax shot. It's more common as you get older to get those bacterial pneumonias, but I think with Parkinson, it's great, you know, to get that. Is there a vaccine for COVID-19, coronavirus? Answer, no. But there are vaccines that are in trials. People are looking at the idea that you can use some of the immune responses and re-inject cells. They're looking at the idea of trying to figure out what we can do to stimulate our own immune system to fight off COVID. But for this particular pandemic, it's going to take a year or more, plus or minus, to get to a vaccine that may or may not immediately work. So don't count on the vaccine to bail you out, okay? Don't count on a COVID vaccine to bail you out. So what can you do, okay? Stay home. Socially isolate 6 feet apart. Wash your hands for 20 seconds or more, okay? Sing happy birthday twice. You can sing happy birthday to anybody that you like, okay? I usually sing happy birthday twice to my kids while I'm washing my hands. Of course, they're not there, but I'm thinking of them. So you can do it. Just sing happy birthday twice while you wash your hands. As Dr. Southwick told us, keep your hands away from this sort of triangle area here, because that's where the spread comes, okay? And so try not to touch your mouth and your face with your hands, and try to keep as clean as you can, but do not depend on the vaccine to bail you out, okay? Don't depend on the vaccine to bail you out, okay? I have a question here from Annie. If a person with Parkinson's disease is headed to the hospital, thank you, Annie, for a live question. In an emergency situation, how and when should they let their Parkinson doctor know? Fantastic. We have this information up on the website, but let me go over it for you because it's so important, okay? If you get sick with COVID-19, okay, you may have no symptoms, okay? You may have mild symptoms, and some people are saying that you may have trouble with smell as your first smell or taste, you know, or getting apathetic, not wanting to do things, or fatigued. Those could be your early symptoms. Or it could be fever and cough, okay? So it's different across different patients and different people. If you get symptoms that you think are consistent with COVID, you immediately contact your doctor's office or your advanced practice provider, your physician assistant, or your nurse practitioner's office immediately, and keep them posted. They will tell you what to do. A lot of times the answer is stay at home and socially isolate. Sometimes the answer is time to come get a test to confirm whether or not you have COVID-19. And sometimes the answer is get in here right away, either to the clinic or to the emergency room. It's super important in this age with this infection that we begin to monitor it from the time of the first symptoms, and that we are communicating directly each day, okay, with our healthcare practitioners so they can tell us what to do, so that you don't rush directly into the clinic and get a whole bunch of other people infected, and also get people that you're with infected. They can isolate you into a room. They can have the personal protective gear ready. They can protect you, and they can protect the other patients. And so it's really important that you don't go directly in without first making that call. So thank you for that question. I have another question here that comes from the West Coast. So welcome to everybody in California. And you know what they want to know about is they would like to know about this idea of risk, okay? And there is this notion that's out there about the risk of getting COVID-19 being higher in a Parkinson's disease patient or group of patients, okay? Let me debunk the myth and tell you what we're trying to communicate, because sometimes we are ineffective communicators, okay? We've got this up at parkinson.org and at parkinsonsecrets.com. We've got all of this information about this and a deep discussion about risk, okay? When we say that a Parkinson patient is in a high-risk group, okay, what we mean is if you get COVID-19, you're at higher risk because you have Parkinson's disease. Okay, you may not move as well, you may not be as quick, your lungs may not be quite as strong, your breathing may not be, exactly as strong. So if you get COVID-19, you're at higher risk, whether you're a young Parkinson patient or whether you're more seasoned than an older Parkinson patient, okay? What we do not have is any data to suggest that the risk is higher in getting the Parkinson disease COVID infection. So getting a COVID infection just because you have Parkinson disease, that risk is higher. Right now, I would call that a myth. I would call that something that we don't have data. Could that be proven positive in the future? Maybe. I'd like to see data for that. When we say high risk, everybody, what we mean, okay, is we mean high risk because you have Parkinson's. So once you've contracted the virus. So what does that mean? That means be preventative. We need to keep you from having it. Now, there are other diseases that have high risks too, so don't feel like you're alone, okay, with Parkinson. If you have certain diseases, particularly diseases like different cancers, if you have diabetes, if you have kidney failure, there are all sorts of diseases that put you at risk if you have Parkinson's disease or one of these diseases once you have the infection, to have a worse outcome and potentially more complications, okay? So that's what we're talking about when we say high risk, okay? And so thank you for that question, and thank you for allowing me to address this, okay? Because it's super important, okay? The next question comes from Tony, and thank you for logging on to this live webcam. We've got people now coming from all over the world, so I see that lighting up on my screen. So thank you, Tony, for bringing up this issue of ventilators. Okay, and we've seen on the news this idea of ventilators, and so let's take a few minutes and talk about ventilators. And what Tony wants to know is how would the Parkinson disease be handled or not handled by medical personnel with ventilators, given the fact they might have things like deep brain stimulation or traditional medications, okay? So first of all, we're doing everything we can here at University of Florida Health. So I'm broadcasting from the Fixel Institute here in Gainesville, Florida. We're doing everything we can, and my day job running the Department of Neurology in the Fixel Institute is we're clearing beds in the hospital, and we're consolidating and making all of our ventilators that we possibly can available to people as they get sick. That's why you see the Navy ships moving in to New York and into Los Angeles and off the coast there. They're going to actually move patients not that have corona, but other patients to make beds available with ventilators. And so we need to get our ventilator capacity up. There's a lot of going on now where we're trying to get the manufacturing of ventilators and repurposing some people's businesses and factories to make more ventilators. So in case we need them, we'll be able to ventilate you if we have that, whether you have Parkinson's disease or not. And so the ventilator issue is absolutely huge. But once you have a breathing tube, okay, what Tony is worried about is, man, I got to get all my Parkinson medications. How is that going to happen? Because now I have a breathing tube. Well, of course, some of the medications we might be able to give by a patch. And then others, we can place a tube through the nose called a Dobhoff tube, and we can give medications through that Dobhoff tube if necessary. So we can still get your Parkinson medications to you, even if you're ventilated. The deep brain stimulator is awesome because that usually stays on, and going on its own. And if you have a Duopa pump, that can still be going. The only thing is that sometimes the deep brain stimulator brings electrical artifact with some of the other machines that we're using to try to monitor you to keep you stable. And sometimes we have to work with the docs to either change the settings to something called bipolar settings, or just adjust where those leads are, which is sort of the answer on most of these things. And so it's super important, and I think that when we think about ventilators and we think about that, I'm hoping that nobody has to go on a ventilator. But if you do have to go on a ventilator, just know that we will be able to get your Parkinson meds to you. We've done this before. The Wear and Care kit can be helpful. And also, if your doctor just doesn't know about ventilators, or your nurse or your healthcare team that's taking care of you, it's possible they just don't know about this. You can always call our 1-800-4PD-INFO hotline, talk to our nurses. They'll be happy to help walk through if there needs to be a walkthrough, and try to help you through this. We have another question following up here on deep brain stimulation. Seems to be popular, so thank you for asking this question from the Midwest. People want to know, are people who have a deep brain stimulator implanted at higher risk for getting the coronavirus as compared to people that do not? Nope, that's a myth. Okay, just because you have a deep brain stimulator in does not put you at higher risk for contracting the coronavirus. We have no data to support that. I don't believe that is true. Is it possible? There is some risk that we'll learn about later on. It's possible, but I would rate this as highly unlikely, and this is a myth. So if you have a deep brain stimulator, you're sitting around going, "Oh my God, like this is going to be really awful." I don't want you to worry. So I think that is really important. The other thing I'd like to talk about is a question that I've seen now from multiple continents. Okay, this one just comes up on my blog, on the Parkinson Secrets blog, comes into the foundation. It's coming in on our live feeds, and this is about pain medications. Okay, and it turns out that a lot of people, when they have a fever, okay, meaning the temperature goes up, okay, in the body, which is a natural reaction to an infection, right? So you get an infection, there's some sort of response, inflammation, and all of these cells in your body rush there to try to clear that infection off, okay? So when that happens and the fever goes up, what do you take? You take Tylenol, you take ibuprofen. These are very common types of drugs. So it is going to be extremely common for people with coronavirus or flu or any other virus to be taking these drugs. Okay, so if you look at a cross-section of these patients, they're going to be really common. Now, there have been reports where people who have been on the ibuprofen have had bad outcomes or have died with the coronavirus. That is what we call an association. People just happen to be taking these medications because they have fevers, they happen to have a complication of something else, and they happen to die. That doesn't mean that Tylenol or ibuprofen caused this at all. So what I tell my patients is these are probably very safe, okay? And I couldn't think of something safer. And it can be unsafe sometimes to let those really high fevers be high. So sometimes you got to bring the fever down, okay? So I haven't been making that recommendation to my patients because I haven't seen any data to suggest this. There has been debunked by the BBC and other outlets, although there have been health officials who have said, look, if you're worried about it, take Tylenol instead of ibuprofen, or take another non-steroidal instead of ibuprofen if you're super worried about it. But we are not. What we are worried about is people having high fevers and allowing those fevers to stay up without taking something to bring the fever down. And so I think that that is a super great question, and I thank all of you. Okay, everybody's asked that question, and this one has really been terrific and has come in. So here's a question from Mamie. Mamie, thank you for writing in here live. Mamie brings up a great point about Parkinson's disease. She has an immune disease called polymyalgia rheumatica, and she takes medicines that suppress her immune system. And so she's been isolating herself, and she's isolated herself for 3 weeks, and she needs to see her doctor soon, and she'll have to go to 3 different locations. She's from the Midwest, from Michigan. And should she wear a mask, and what should she do? Okay, Mamie, thank you for the question, okay? So this happens, okay? You have somebody with Parkinson's disease, okay, and you have somebody with an immune problem like polymyalgia or rheumatoid arthritis or multiple sclerosis or something where they need a drug called an immunosuppressant, okay? A drug that is going to help to calm the immune system down so that their rheumatoid arthritis or the polymyalgia doesn't attack the rest of their body and they can't live and it becomes unbearable. So these immunosuppressants are super important for a lot of diseases that involve inflammation and other really important aspects of controlling immune function. Once we knock immune function down, so if you have Parkinson in one of these diseases and you're on one of these immunosuppressants, so like steroids, okay, corticosteroids like prednisone would be one, or if you're on any of these types of drugs that you see on TV, you know, for your rheumatoid arthritis or your irritable bowel syndrome or your inflammatory bowel, not irritable bowel, but your inflammatory bowel syndrome, Crohn's or ulcerative colitis. If you're on these drugs that suppress the immune system, you are at increased risk, okay, because you're immunosuppressed to pick up a virus like the coronavirus. So, Mamie, you're doing all the right things right now. Washing your hands all the time, fantastic. Socially isolating for 3 weeks, fantastic. You've kept yourself totally clean. Now you're in a position where you may have to see your doctor, okay? First of all, call your doctor, because I doubt you're going to need 3 appointments in 3 places. So hopefully they're going to be able to consolidate that down. Maybe they can even see you through telemedicine, okay? If they can see you through telemedicine, okay, and because they may not need much physical exam, or through FaceTime, okay, and the government in the United States has waived the HIPAA, the Health Information Privacy, so that means we can use FaceTime, Skype, Zoom, any of these platforms, and we're not worried about getting sued as healthcare providers, or even if somebody steals the information. Right now we're in crisis. The government has recognized that, and so we can use platforms to get to you. What I want you to do is I want you to talk to the doctors and see, can you consolidate me into a single visit, and can it be done through telemedicine? If it can't, because you're immunosuppressed, then you want to be sure that whoever's taking you to that appointment, you stay socially isolated, you stay in the car, you don't go into a crowded waiting room. You might even send somebody else in before you go, and you try to make sure that the transitions happen, so you're staying away from things, surfaces are wiped down, and then you get in and out as fast as you can. That would be my best advice. In terms of face masks, there's all sorts of stuff about face masks. In general, face masks are not useful, although now we're beginning to see some data, particularly in people who are immunosuppressed, that maybe this might be a case where if you're in that environment, if you happen to have one, we don't want to use up PPE for people that need it, but particularly if you're immunosuppressed, you happen to have one, wouldn't be a bad idea to put it on. We don't have a lot of data right now to support that, but I think it's reasonable in somebody who's immunosuppressed trying to make sure they don't get the virus. The face masks are actually better on the people who actually have the virus, but we don't know who those people are. So thank you, Mamie, for the question. Stay safe and try to keep things and to really do all the things that you're doing and try to stay at home. See if there's a technological solution for you. That would be really awesome for you and for others. So the other question that we received here, this is a question that comes from the Colorado region, and it's on Amantadine. And we've actually seen this question. I've seen it on my blog. We've seen it at Parkinson.org. You know, I've seen it multiple times from Florida. I've seen it from Kansas. I've seen it from New York. I've seen it from South America. Amantadine. Why not take Amantadine? Okay, we have a coronavirus outbreak. Okay, and with the coronavirus outbreak, we happen to have an antiviral drug that we use to treat mostly dyskinesia, sometimes other Parkinson's symptoms, but mainly most of the data is on dyskinesia that we see. Why don't we just use Amantadine to treat the corona? Well, there's absolutely no data that shows that this is an effective strategy. Okay, so that's the first thing that I would say. The second thing is that amantadine was decommissioned by the Centers for Disease Control around 2005, 6, somewhere in there, as an antiviral drug, and then it remained in use for Parkinson patients, and then some patients take it to treat fatigue for other diseases like multiple sclerosis. Now, it turns out that amantadine can positively affect the dopaminergic system, and it can affect another chemical in the brain called glutamate to suppress those dyskinesias. And so do we know that amantadine can have any antiviral effects against this particular coronavirus? No. Do I think it does? Here's my best guess. No. The reason I don't think that it will is because of how amantadine blocks the virus. It doesn't work on the RNA component. So there's DNA, okay, deoxyribonucleic acid, and then there's RNA, ribonucleic acid. And it turns out that the drugs that we're seeing hits on, and if we see how coronavirus works, seem to be directed against the RNA. So people have talked about drugs like chloroquine, for example. So amantadine doesn't really act in that way, and so I'm not like really excited about that as a treatment. Now, in terms of drugs like chloroquine or others that might affect the RNA, it's possible. But I will tell you that chloroquine has come up in drug screens. Even anti-malarial drugs have come up as positive as drug screens for potential Parkinson's disease treatments over the years, which is super, super interesting. Okay. And one thing that I would say is that it's really important for us to keep in mind that we shouldn't all run out to get chloroquine. Okay. One, we don't know if it works. Two, we need data, as Dr. Fauci told us from the National Institutes of Health. We need data, and if we're getting it, we should get some data with it. Three, we don't know if it does work. Is it preventative? Is it symptomatic? Who does it work on? Four, it has toxicity. And when a lot of these reports got out, people started taking a lot of chloroquine. We saw reports from Africa and other regions of the world where we saw people getting into toxicities with these drugs. And if it does work for a particular situation, which is usually what happens when we find a drug works, we need to use it in that situation, and we need to preserve the supplies for that situation. So until we know more, given the toxicity and given our long history with using drugs like chloroquine for all sorts of diseases, I would say let's hold off on the chloroquine. I know I'm getting comments from all over the world and people asking for prescriptions for it, but I would say let's hold off on the chloroquine. That's a super important, but keep an eye on it. But one thing I want everybody who's watching to keep in mind is that the reason we're interested in chloroquine is because it affects the RNA. Okay, and that may be important to shutting down the coronavirus. Okay, and so look at those drugs, that class of drugs, and there might be something there. So there's a whole bunch of researchers working, and I have seen in the last 72 hours calls from all sorts of foundations, the National Institutes of Health and other people for research projects focused on corona. So the entire research networks all over the world are now galvanizing together, which is awesome. Okay, and you're going to see lots of corona-based research coming out, and that can only be helpful both for development of drugs and later development of vaccines, which, remember I told you, are at least a year out, so we need to be preventative. Here is an awesome question, okay, an awesome question from overseas about grocery shopping, okay? So many of us are under these orders, not only to socially isolate, but different lockdown orders, different quarantine orders, depending on where you live in the world, depending on your locality, depending on your state, and even depending on your county. Okay, so we're in a lockdown type of situation here, and they have a decree out, and there's very specific things you can and can't do in order to promote social isolation. So what about grocery shopping? Well, it turns out there's some really nice things now in the modern age that you can do for grocery shopping. You can sign up for different services like Amazon in certain regions, partners with Whole Foods, Instacart. And I don't want to promote anybody's single service, so I want you to go out there and look and see in your area, do a web search that says who delivers groceries, in this zip code, and see what it is, because I'm not here to promote anybody's individual business, although we need to keep these businesses alive as much as we can. So it is helpful for these drivers and these people to get some work. But you can order, okay, your food, and it can be dropped off at your door. You can do it on a credit card, and they will leave it at the door, ring your doorbell, leave it at the door, and you don't even have to talk to the person. So, and you can bring it in and wash your hands, throw away the bags, get rid of all the wrappers, wipe things down, wipe the surfaces down, and you can get food in very efficiently and very safely. And a lot of people are doing this now. You see even people like Sanjay Gupta, who's a very famous commentator for CNN. This is what he does when he orders food in. My own family, we do this same thing. And so it keeps us at home and keeps our delivery drivers with a little bit of work to do, and really is helping with socially isolating. So a great question. This one came from overseas, but it applies to all of you here in the United States. It is super, super important. Okay. We have another question that's just coming in now, and it's a question about elective surgeries, and the question is about proceeding with an elective surgery like an eye surgery. So you got a cataract, you can't see, you've had it scheduled for a long time. Should I proceed with that surgery? The answer to that question is no. As we discussed with deep brain stimulation before, you have to decide whether or not it's elective or not, and it can wait or not. It's non-urgent. It's not going to be life-threatening, okay? And it's not going to cause severe disability, waiting a few months, if necessary, weeks to months to get this done. So a cataract would be a definite elective surgery. Deep brain stimulation in Parkinson's disease would not necessarily be an elective surgery to have a battery replacement, as we talked about earlier. So you have to go through and you need to talk to your doctor and talk it through. It's to protect you. It's to also conserve the personal protective gear for our healthcare workers who are out there on the front lines for you, many of whom are getting sick. And as more of us get sick, guess what? We're not going to be there to take care of you. So you see all these great signs with all, particularly nurses and physicians and healthcare professionals in groups at hospitals. You know, they should be socially isolated. They should be 6 feet away. But you see they're holding up signs that say, "We take care of you, so please stay home to take care of us." So trying to keep the virus down. So a cataract would be an elective procedure. Dental procedures, okay, unless there's an infection in your mouth, most of these dental procedures can wait, and dental cleanings can wait. And if you can wait, all the better. If you can't because of infection that might spread, then I think it's super important. Another question that just came in from Scott, thank you, Scott, is about one of his family members who had a deep brain stimulator implanted, and now they can't do the battery placement yet for the stimulator. And so is it okay to wait to place that battery until the corona crisis subsides? The answer is in most cases yes. If there's life-threatening extra movements, these extra, terrible, what we call storm movements of postures or movements, and it becomes so uncomfortable, you might make an argument to your team, but most of the people that have the leads in place and are waiting for the batteries can be managed with medications during that period. And if the battery runs out and for some reason, no matter what, you can't get a battery and you're having a crisis, talk to your doctors every day to get your medications readjusted to get you in a state where you'll be able to make it through, okay, the impending crisis. And so, super important, and just a super question, and I really appreciate that question. So thank you for asking that. So here we're also seeing lots of people writing in saying they're getting deliveries at home, which is great. We're seeing people write in and tell us about their DBS operations and asking lots of questions. There are also questions that come up now, and I'm seeing a few up here. Just because you're trying to take care of your Parkinson's disease and you can't get into your doctor. And so a question that just came in from Stephen is about how do I know if I'm taking too many pills? Again, call your doctors. Your doctors can now do something called telephone encounters. Okay, they can, and now in the corona crisis, they've waived a lot of the rules, so they can do telephone encounters and they can do telemedicine encounters. They can talk to you on the phone and they can walk you through this. And so if you think you're on too many pills, or you think that you need to change the interval, a lot of times it's the timing of the pills. You want to get with them and still try to get care, even though you're stuck. It doesn't mean you can't reach out to these practices, ask them for telephone consultations, ask them to give you 3-month supplies of your medicines. Okay, remember, if you haven't done that, 3-month supplies of medicines is super super important. And so thank you for that question. We have another question that's coming in right now, and that question is from Danielle. Thank you, Danielle, for writing in here live. She has a father with Parkinson's disease who lives alone, has a caregiver coming in several times a week, and most of the family is still working. And should dad be kept away from the family, and especially like family dinners once a week, what should we do? There's even a baby in the family. This is really tough. I don't want to tell people you can't see your family, but, there will be an end to this crisis. It may take weeks to months. And the safest advice that I can give you is to separate potential vectors, potential people that could carry the virus to your dad as much as possible. So family dinners, not a great idea. They can spread. We saw this in the New Jersey area with a couple of tragedies there, with regular family dinner. So especially if you have somebody in the family with Parkinson, best to really isolate them and limit the number of people way down, and the number of caregivers, as we talked about at the beginning, way down, and super, super important to emphasize this. And I think that I don't want to sound alarmist, and I don't want to sound like I'm not feeling that I know it's important to have your family together, but from the experiences that we've been following now in the medical community in Italy and Spain and China and South Korea, it's much better to open the screen of your laptop and put it on the table and have family dinner together in that way, and try not to expose multiple people who aren't in the same house. And so your father who lives alone, exposing them to all these people would be potentially not a really a great idea if it can be avoided. And so I think that is really something that is super super important. So let's see, we've got some more questions coming in. There are questions coming in now, multiple questions. One here from the Gulf Coast. I'm assuming this is the Gulf Coast of Florida. So welcome for your question. And the question is about, you talked about delivery, but there are areas in the world, remember that question came in from overseas, and so there are areas in the world where we don't have access to the same delivery services. And what if we don't have access and we have to go to the store? What's the best thing that we can do? Okay, so the best thing you can do is to look for places where you could potentially call in your order, even at a grocery store, stay in your car and have them bring it out to you in the car. Have hand sanitizer, okay, some sort of hand sanitizer like I've got right here. And in the car, make sure you're sanitizing your hands a lot. And then when you get home, throw away the bags, get rid of the wrappers, wipe everything down. If you have to go into the store, okay, then you want to make sure that you sit in your car and you time it so you're staying as far away from people as possible. And the people in the stores, everybody's attuned to this now, and just avoid crowds. Sometimes people will go at times, like you look at the times when things are open, try to choose a time, and just be patient. We're all stuck anyway at home. Just be patient and don't go in to that store if you see it's crowded. Go in when things have died down, and go in, take care of your business. You see your neighbor, say, talk to the hand, say, I love you, but you need to back off, call me later, not time to talk. Same when you're walking around your neighborhood. It's okay to take a walk and get out of cabin fever, okay? And I often say in one of our blogs here, blog posts on parkinsonsecrets.com, is about cabin fever. You'd rather have cabin fever than corona fever. So if you're not feeling cabin fever, then you're doing something wrong. And so, if you do have to go out, make sure you socially distance yourself, and make sure that you're taking all the precautions, washing your hands and using hand sanitizer. So there's time for one final question, and we've been asked a number of times to explain the term pandemic and Parkinson, and Ray Dorsey and Boss Bloom and I, along with Todd Shearer, have recently written this book called Ending Parkinson's Disease. So a shameless plug here for the book. But the reason I'm bringing it out is because I'd like to read you an excerpt and explain a little bit about pandemic and what is a pandemic, and because we have referred to Parkinson's disease in some sense as a pandemic. Now we know that the word pan means all. It's a Greek Latin derivation from the mid 1800s, and we know that demos means people, so all people. So maybe now in the modern age we use the term for infectious diseases and reserve it for the World Health Organization, but it hasn't, as a word in Webster's dictionary, always been used in that way. And so I'm just going to read you a little excerpt about Parkinson just for fun, out of the Ending Parkinson book. So the section is titled A New Kind of Pandemic. It says, epidemiology is the study of what comes upon groups of people, according to the late population expert, Dr. Abel Omran. For most of history, what has come upon people are famines and infectious diseases, sometimes in the form of a pandemic. As opposed to epidemics, which are limited to a given community, pandemics cover large geographic areas. The Black Death killed up to 200 million people throughout Europe and Asia in the 14th century. The influenza pandemic of 1918 killed between 50 million and 100 million people worldwide and led to unprecedented drop in global life expectancy. Thanks to public health advances, infectious diseases are no longer the source of death and disability as they once were. The new leader of the pack for this is actually chronic conditions. And in his 1971 landmark paper on population change, Dr. Omran called our current era the age of degenerative and man-made diseases. Among these are cancer, diabetes, heart disease, and Parkinson's. This transition has led to expand the definition of pandemic to include diseases that are not infectious. The new carriers or vectors of these diseases are not bacteria or viruses, but urbanization. As the population ages, we have globalization, and in the widespread availability of unhealthy products. So Parkinson's disease actually satisfies many of the criteria of a pandemic. The disease is found everywhere in the world. It's in almost every region. The rate of Parkinson is increasing. And in addition, as with infectious pandemics, Parkinson's disease appears to be spreading and growing as industrialization expands. So what I will tell you is there's a great argument as to whether or not we should use this word pandemic, and we probably shouldn't with Parkinson. Okay, we should probably now turn to use this word to refer to infectious diseases like the coronavirus pandemic that we're dealing with now. But as a word, historically, pandemic didn't always mean it had to be an infectious disease. And when we looked at Parkinson's disease, and we look at it carefully, we're now dealing with something that over a lifetime, 1 in 15 of us will get this. It's more rapidly expanding and growing than even Alzheimer's disease. It's on all areas of the planet. It's in all continents and all regions. And so it does, whether you call it pandemic or not, it does meet these criteria. So one of the thoughts that I'll leave you with, and one of the sort of fun discussions that Dr. Dorsey and Dr. Bloom and Dr. Shearer and I always have, is about pandemic or not. And so I think it's less important, that we say Parkinson's disease is a pandemic. I think it's more important for us to recognize it's on every continent, it's growing rapidly, and it involves all people. It's not sparing anyone, men, women, in different cultures. And so with that, I know that you all are stuck in your homes for this crisis. We are so just proud of everybody for being able to use all the resources that are available to you. I want to remind you, parkinson.org /coronavirus. We have all of our information posted up there. You can get a free Aware and Care kit. We've now given out more than 100,000 of them in case you have to go to the hospital. You can call our 1-800 helpline and speak to a nurse anytime, or a healthcare professional anytime with any of your questions since you're stuck at home. 1-800-4PD-INFO. Wash your hands, stay socially distanced, get 3 months of medication, and be sure when you contact your doctor's office, you ask them, do you have a way you can see me over the phone or through telemedicine to keep me safe? So everybody, stay safe in the pandemic crisis. I'm going to sign off from the Fixel studio here at the Norman Fixel Institute for Neurological Diseases. I'm going to thank the Parkinson Foundation for providing this Facebook Live educational series, and we will be here to answer your questions throughout the crisis. And so stay safe and keep writing and keep letting us know if there's anything we can do to help. Thank you to all of you all over the world who have been writing in, and I'm sorry I couldn't get to everybody's questions, but please call our helpline. We're happy to try to answer all your questions, and stay safe and have a great day.